As part of the educational content for our 2013 Thrombosis Summit, I'll be giving a talk on the link between venous thromboembolism and malignancy. The population of patients living with cancer is increasing in the United States, and venous thromboembolism has been associated with cancer even dating back to early times in medicine. Trousseau was one of the first clinicians to actually associate venous thromboembolism, in particular deep vein thrombosis, with patients who have malignancy. Now we know that venous thromboembolism is associated with all types of malignancy. It used to be thought that venous thromboembolism was just associated with solid tumors, but we now know that its increased incidence can be seen in patients who have liquid tumors like leukemia or lymphoma. We also know that important cancer therapies such as chemotherapy, drugs to boost the production of blood cells, and some new biologic therapies are associated with an increased risk of venous thromboembolism. Now, the reason for this increased risk in the setting of cancer isn't entirely clear, but important studies have recently helped to elucidate that it's a combination of a hypercoagulable state, endothelial injury, and stasis, which we know classically as Virchow's triad. But there are other important considerations in this increased risk of venous thromboembolism with malignancy. There are factors that relate to tumor biology, activation of the coagulation cascade, and even inflammation that further increase the risk. Over the course of my talk, I'll discuss the role of tissue factor, an important protein on the surface of tumor cells that induce coagulation or blood clot formation, and the role of circulating microparticles, which actually contain tissue factor and spread throughout the body, increasing the risk of thrombosis. I'll talk about ways of preventing thrombosis in patients with malignancy and important advances we have in the treatment of thrombosis in the setting of malignancy. I'll draw important distinctions on different techniques we have for treating thrombosis in the setting of malignancy and some of the benefits of the therapies that we use. And then I'll talk a little bit about the importance of preventing venous thromboembolism in patients who are undergoing cancer therapy. In our own work at Brigham and Women's Hospital and Dana-Farber, we found that in general the application of prophylaxis for patients with cancer who are at high risk for thrombosis is inconsistent, and we'll talk about some of those barriers. I hope that you'll join me for the 2013 Thrombosis Forum, not just to learn more about the link between venous thromboembolism and cancer, but to hear about other important topics in thrombosis medicine. Thank you.